Today on ELN Morning.
The doctor's in. University Medical Director Dr. Jeanette Archnell joins us live in studio to discuss boosters, masks, and more moving forward this spring.
Making money. Student employees will soon see more cash added to their paychecks.
And Into the Woods. The Performing Arts Department's spring season begins tomorrow night with a Broadway classic.
Today, February 10th, 2022.
This is ELN Morning.
Breaking overnight, 25 North Carolina National Guard members arrive at Alamance Regional Medical Center to support staff and hospital operations.
Cone Health medical staff requested the assistance last month during the rise in Omicron cases. The Guardsmen are scheduled to remain on site through March 4th. We begin our coverage here. Good Thursday morning, everyone. I'm Baylor Rodman.
And I'm Ashlyn DeLoughy. You're watching ELN Morning. Guard members will support hospital staff and operations, assisting with vital sign checks, COVID-19 testing, patient check-ins, meal delivery, and transportation.
This comes as cases declined 46% in Alamance County over the past week, and hospitalizations start to slow, closely following state and national trends, according to federal data from the Center Disease for Control and Prevention.
Joining us now to weigh in on all of this, as well as talking boosters, masks, and more, is University Medical Director Dr. Jeanette Archnell.
Dr. Archnell, good morning to you.
Thanks
for being with us today. So I want to start just a little bit, any contextualization you can provide with National Guard coming in. Is it too little, too late? I mean, the cases are starting to decrease now. You know, they were called in January. How can they, be of help?
It's a good question. The problem is that even though cases are dropping, cases are still really high. And I think that's what everybody is forgetting across the country. One of the problems with COVID has been the problem with staffing hospitals everywhere. People haven't been able to take leave. People have gotten sick because they're working too many hours, all of that. So all those people who worked through the surge, the real peak of Omicron, they're now burnt out and collapsing, and any assistance anybody can give is going to be beneficial. You'll notice none of these are clinical roles that the National Guard are doing. And I think that's important for patients and the community to know, that you're still going to be taken care of by doctors and nurses and fully qualified staff. It's the support people whom we always forget about in these crises. That's where we're going to have extra support, and they deserve help.
Well, also making headlines this week as well is the rollback on mask mandates in various states. In Connecticut, New Jersey, and Delaware, they have all set timelines right now for the end of their schools' mask mandates. Here in Raleigh, the mayor just recently said, we're just not there yet in terms of rolling back that mask mandate here in the state. With that said, what is your advice to students, faculty, and staff as we sort of move about the next few weeks, and leaders here in the state and across the country are sort of making decisions on loosening those requirements?
Well, I think the first thing we need to remember is that even though the Omicron surge is going down and cases are much, much lower, we're still almost at the same number of cases as we were at the peak of Delta. Okay? COVID hasn't gone away.
Yeah.
It's just fewer people are dying from it. So that's number one. Number two is masks aren't just helpful against COVID. They're helpful against flu, the common cold, which is very often another coronavirus, mono, strep. So anytime anybody is sick, whether there's a mask mandate or not, people should be wearing masks. So we need to put things in context. It's not everything's gone away. Yeah. We will never be back to 2019.
Okay. So would it be the advice, though, soon to potentially set a specific date? I know a lot of students were frustrated because, you're going to be unmasked after the first 2 weeks because you were vaccinated, and then that was extended, and then extended to the end of the semester, and then you were going to be boosted and taken off, and that was extended. So I understand the hesitancy to set another date, to not go ahead and do that. But as other leaders start to do that, is that something that maybe we can expect to see soon?
I can tell you it's definitely under discussion. It is always under discussion. The problem and the difficulty is that if people choose a number, then you can get, you're stuck with that number, and it tells you nothing about what's going on. We have a wonderful vaccination and booster rate on campus, faculty, staff, and students. But in the surrounding community, Guilford County has I think it's about a 59% vaccination rate.
Okay.
Alamance County has a 57.
Right.
Rockingham County hasn't even hit 50%. We don't really live in the ELN bubble. And one of the things the university has to take into account is not just what's on campus, but what everyone is exposed to off campus. So while I'd love to give you a date, I'm not going to go there.
That's good. So you mentioned boosters. There's 4 more booster clinics. There's a few students who were deferred from those. I know we have to run, but is there any update on, if they just had COVID, like what that process sort of looks like?
Okay, if you've had COVID in the last 90 days, medically you can get your booster immediately. It's not a problem. But because we know you have some boost, in a sense, from getting the illness, you can defer that booster for 90 days, so long as the university knows you've had COVID and has proof.
Sure. All right. Well, for those who haven't received their booster shot yet, there are 4 clinics, as we said, and they're scheduled. You can schedule to get yours on campus between now and spring break. Registration is strongly recommended, but you can walk in if doses are available.
Dr. Jeanette Archinal, thank you so much for your time this
My
morning.
pleasure.
We hope to see you back soon.
Okay.
Thank you so much. All right, well, this Saturday, the student wage for on-campus jobs will be increasing from $9 an hour to $10. The change comes after the university instituted COVID-19 related budget changes, halting students from their 25-cent raise per semester. ELN sophomore Sydney Brown has had 2 on-campus jobs and says the $1 increase makes a big difference.
I feel really good about it. I know that me specifically, I'm trying to save a bunch of money to move off campus next year, and with the 2 jobs that I have, it's going to be a lot more in the long run. So even just a little bit is good.
ELN senior Jacob Heil is pleased with the increase, but hopes the university will revisit student wages again soon.
And I think it's a fine starting point. I mean, I get the aspect of from an economic standpoint, from the university's perspective, having to roll out these changes. But I think on top of that, I know in the NC legislature, there's a bill talking about making $15 the minimum wage. So I mean, eventually the university, despite it being a private university, needs to get to that point as well.
Students can expect to see the change reflected in their next paycheck.
February is American Heart Month. Now is the perfect time for people to check in with their bodies and their habits. ELN professor Tracy Thurn specializes in cardiology. She says indicators of heart disease are things like unhealthy eating, not exercising enough, and being stressed. Thurn says studies found more than half of college-age people have at least one of these indicators.
If something fails within the heart, which I kind of equate it to the engine, right, in a car, then you're going to know it, and you're going to have symptoms, and you're not going to be able to perform the way you used to perform. You're not going to be able to have the stamina you used to have, and you're just not going to feel great. And so the heart is a very important organ in our body.
She says students need to practice healthy eating and exercise now to prevent problems down the road.
It's 9 minutes after the hour now, and our Margaret Faust joins us live on Zitron Plaza for a look at the weather ahead.
Margaret, good morning. I hear it's going to be pretty warm out there today.
Good morning, Ashlyn and Baylor. Yes, it's going to be warmer in the afternoon, but it is chilly right now. Let's take a look at the weather for the rest of today and tonight. Temperatures are going to hit about 66 degrees in the afternoon, which is great, but they're going to dip to around the mid-40s tonight. So if you're going to be out and about, make sure to grab a jacket. Now let's take a look at your Phoenix 5-day forecast. Tomorrow and Saturday are going to be sunny, with the warmest temperatures in the afternoon. And on Sunday, there is a 40% chance of snow, so make sure to stay inside and stay warm to close out your weekend. And looking ahead to next week, it's going to be all sun, but the temperatures are ranging anywhere from 40 to 60 degrees, so stay on your toes. Ashlyn and Baylor, back to you.
All right, Margaret Faust, live on Citron Plaza with the 5-day this morning. Margaret, thank you.
ELN Performing Arts Department is set to premiere the Broadway classic Into the Woods this weekend as this year's spring musical. Senior Skylar Sayaski has not performed on stage since the pandemic. She says portraying Cinderella on stage could not be a better way to close out her college experience.
The story and the musical is why I started doing theater, and this is my first time ever playing her, and so it's kind of like a little dream come true. And to close out my college experience performing such a important role to me, it's a dream.
Junior Brooks Andrew came to ELN to pursue musical theater. He says the intense nature of the winter term rehearsal process helped prepare him for the challenging industry he plans to enter.
When I have moments like these where I get to put on a costume like this and I get to actually like sit down for a month and only focus on performing a show and working on a character and getting to put to use the skills that I'm learning here, it really proves to me that I made the right decision.
Into the Woods is set to open tomorrow in McCrary Theater at 7:30 p.m. with performances continuing through Sunday. Tickets are free for students with proof of Phoenix card and can be purchased for the general public at elon.universitytickets.com. Right across the train tracks, you'll find Elon Oaks Veterinarian Hospital. They're working to get more of their staff trained to help calm pets' anxiety when coming to the vet. Hospital manager Allie Hall says humans are the only ones nervous about going to the doctor.
Been starting from the age of a puppy so that they don't have to be afraid and they can be comfortable when they come in, and it just makes the exams and the getting blood samples or vaccinations just a lot more pleasant or a lot more doable for the pet, and they don't have to be so scared.
So you've got a pet on campus who might need dental care. There's also a 10% discount through the end of February.
Yeah, because it's National Pet Dental Care Month.
Yeah, and my cat actually needed dental care pretty recently. So this is definitely an essential need, for sure.
Absolutely. Listen, that's all the news we have for you right now this morning, but we hope to see you at Org Fair, which is later today from 4